Today will be discuss MCQs on endocrine systems. The first question we'll be discussing is cold intolerance is found in option A hypothyroidism, option B hyperthyroidism, option C hypoparathyroidism, option D hyperparathyroidism. Correct option here is hypothyroidism. Hypothyroidism. We'll see what is the cause of this hypothyroidism is due to decreased production of T3 and T4. This hypothyroidism is also known as myxedema in adult, and in children is known as cretinism. It is congenital in children and it is known as cretinism. In children. So cold intolerance is found in which type of patient? In hypothyroid patient. And this hyperthyroidism is known as heat intolerance. Patient with hyperthyroidism is very sensitive to heat, and this hyperthyroidism is also known as thyrotoxicosis. Please be very careful when this type of question came. Hypothyroidism is known as myxedema in case of adult, and in case of children is known as cretinism, and it is caused due to decreased production of T3, T4, whereas hyperthyroidism is also known as hyperthyrotoxicosis. It's a heat. Patient with hyperthyroidism are very sensitive to heat or heat intolerance, and it is caused due to increased production of T3 and T4. Next question we'll see. Antidiuretic hormone is secreted by option A anterior pituitary, option B posterior pituitary, option C pancreatic beta cells, option D adrenal gland. We will discuss each one of them. This anterior pituitary, correct answer first we'll see is posterior pituitary gland. This posterior pituitary glands they secreted antidiuretic hormone, which is also known as vasopressin, and also oxytocin. This posterior pituitary gland secreted these two hormones, ADH antidiuretic hormone or vasopressin and oxytocin 1 and 2, whereas anterior pituitary gland secreted so many hormones, include growth hormone, thyroid growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, prolactin, follicle stimulating hormone, LH and MSH, melanocyte stimulating hormone. There are 7 hormones secreted by anterior pituitary glands. I'll repeat. First is growth hormone, second is thyroid stimulating hormones, third one is adrenocorticotropic hormone, fourth one is prolactin, fifth one is follicle stimulating hormone, sixth one is luteinizing hormone, and seventh one is melanocyte stimulating hormone. This pancreatic beta cells secreted insulin, secreted by beta cells, where gamma cells, alpha cells secrete glucagon, where delta cells secreted somatostatin. These 3 hormones secreted by the pancreas. Beta cells secretes insulin, alpha cells secrete glucagon, delta cells secreted by somatostatin. Delta cells secrete somatostatin. Adrenal glands further is divided into two: adrenal cortex and adrenal medulla. Adrenal cortex secretes mineralocorticoids and glucocorticoids, whereas adrenal medulla secreted adrenaline, epinephrine, adrenaline also known as epinephrine, or noradrenaline, or norepinephrine. Noradrenaline is also known as norepinephrine. I hope you get all this. Adrenal glands is divided into adrenal cortex and adrenal medulla. I'll repeat. Adrenal cortex secreted mineralocorticoids and glucocorticoids, whereas adrenal medulla secreted adrenaline and noradrenaline. Adrenaline also known as epinephrine, whereas noradrenaline is known as norepinephrine. Next questions. The nurse should teach the diabetic client that which of the following is the most common symptoms of hypoglycemia? Option A, nervousness. Option B, anorexia. Option C, Kussmaul's respiration. Option D, acetone breath. Correct answer here is A, nervousness. These two, Kussmaul respiration and acetone breath, is present in DKA, diabetic ketoacidosis. Kussmaul respiration is increase in rate and depth of respiration, positive and present in acidosis. This acetone breath also is present in diabetic ketoacidosis. So correct answer here, hypoglycemia patient, they are usually exhibiting clinical manifestation of nervousness. Next question. Thymus gland plays an important role in option A, maintenance of blood pressure, B, homeostasis, C, immunity, D, thermoregulation. Correct answer here is immunity. Why? Because maintenance of blood pressure is maintained by renin. There is a system known as RAAS. Renin, angiotensin, aldosterone system. This system usually maintains blood pressure. Thermoregulation is usually maintained by hypothalamus. So from here we know that maintenance of blood pressure is done by the renin, angiotensin, aldosterone system, whereas thermoregulation is maintained by hypothalamus. So we are left with these two, homeostasis and immunity. Homeostasis is not maintained by thymus glands, it maintains immunity. So correct answer here is immunity. Next question. ADH or vasopressin is option A, enzyme that hydrolyzes peptides, B, hormone secreted by pituitary and promotes reabsorption of water from glomerular filtrate, option C, hormone that promotes glycogenolysis, option D, energy rich compound connected with muscle contraction. Correct answer here is B. This ADH is hormone secreted by pituitary, posterior pituitary, as we have already discussed, which promotes reabsorption of water from glomerular filtrate. So option here is B. Next questions. Low levels of adrenal cortex hormone results in option A, Addison's disease, B, Cushing syndrome, C, diabetes, D, tetany, E, goiter. This goiter and tetany is caused due to hypocalcemia. Goiter is due to hyperthyroidism. We have enlargement of neck due to hyperthyroidism. Diabetes is due to insulin impairment. Cushing syndrome is due to increased production of adrenal hormones. We have already discussed this other two the hormones secreted by adrenal glands, adrenal cortex and adrenal medulla. Adrenal cortex secreted those mineralocorticoids and glucocorticoids. And glucocorticoids, and actually they secrete one mineralocorticoids, glucocorticoids and androgen. So low levels of adrenal cortex hormone results in correct answer here is Addison's disease. If there is increased production, the correct answer will be Cushing syndrome. Increased production of adrenal hormones, increased production will cause Cushing syndrome, whereas low levels of adrenal cortex hormone results in Addison's disease. Next question. Monofilament test on a patient with diabetes mellitus is used to detect option A, neuropathy, option B, visual acuity, option D, motor response, option D, reflexes. Correct answer here is A, neuropathy. Next question. Which of the following test results would be consistent with a diagnosis of Cushing disease? Option A, postprandial hypoglycemia, option B, hypokalemia, option C, hypernatremia, option D, decreased urinary calcium. Correct answer here is hypernatremia. Patient with Cushing disease, there are clinical manifestation, there are developing hypernatremia. Next questions. Polyphagia is a feature of A, diabetes insipidus, B, acromegaly, C, hypopituitarism, D, diabetes mellitus. Correct answer here, diabetes mellitus. 3Ps is present in diabetes mellitus. Polyphagia, increased appetite. Polyphagia means increased appetite. Polydipsia, increased thirst, and polyuria, increased urination. These are the 3 P's present in diabetic mellitus. This is frequently asked questions for us. What are the 3 P's present in diabetes mellitus? So correct answer here, polyphagia, polydipsia and polyuria. Acromegaly, it's acromegaly is hyper secretion of growth hormone, increased production of growth hormone is acromegaly. And okay, next question we'll see. Nurse vein is aware that positive Chopek signs indicate option A, hypocalcemia, option B, hyponatremia, option C, hypokalemia, option D, hypermagnesemia. Correct answer here is hypocalcemia. We all know that Chopek sign is a clinical features, is clinical signs of hypocalcemia. It is due to twisting of facial muscles while tapping of facial nerve. Chopek signs, and there is one more signs which is present in hypocalcemia, that is known as Trossard sign. TROUSEOU sign. This also is due to hypocalcemia. There is carpopedal spasm. Carpopedal spasm. Trossard sign. So these two, first one is the Trossard sign, Chopet signs, and the second one is the Trossard sign. These are clinical signs are present in patient with hypocalcemia. Next questions is both of the signs are very commonly asked in previous exams. Next question, assessment of the diabetic line for common complications should always include examination of option A, abdomen, option B, lymph glands, option C, pharynx, option D, eyes. Correct answer here is eyes. Why? Because diabetes cause diabetic retinopathy, impairment in the blood circulation in the eye, retinal impairment, blood circulation in the retina. That's why it causes diabetic retinopathy, blood circulation in retina. Sorry. Next question we'll see. The adrenal glands consist of A, inner and outer layer of the kidney, B, inner and medulla and outer cortex, C, lower adrenal and upper para-adrenal sections, D, ACTH and BCTH sections. I have already discussed in the previous questions that the adrenal gland contain of inner medulla and outer cortex, and each of them secretes different types of hormones. Next, pituitary glands are otherwise known as A, regulatory glands, B, master gland, C, exocrine gland, D, hypothalamus. Pituitary glands is also known as master gland. Next question. Which hormone possesses anti-insulin effect? Which of the following among these hormones possess anti-insulin effect? Option A, cortisol, option B, calcitonin, option C, oxytocin, option D, aldosterone. Correct answer here is cortisols. There are 4 or 5 hormones which is known as counter-regulatory hormone. These hormones, their action is opposite to insulin. Includes cortisol, growth hormone, glucagon, thyroxine, adrenaline, and noradrenaline. These hormones has effect which is anti-insulin effect. Next questions. Calcitonin decrease blood calcium level. Oxytocin helps in milk letdown reflex. Prolactin, as we all know, helps in lactation. Next question we'll see. Parathyroid hormone action. Option A, stops the absorption of calcium from the intestine. Option B, stimulates the release of calcium by the kidneys. Option C, causes blood calcium level to decrease. Option D, causes blood phosphate level to decrease. Correct answer here of parathyroid hormone or PAR hormone is D, cause blood phosphate level to decrease. This calcium level to decrease, it is done by the calcitonin Whereas parathyroid hormone, it increase the blood calcium level, parathyroid hormone causes blood calcium level to increase. So correct answer here, D causes blood phosphate. It also causes blood phosphate level to decrease. Buffalo hum is a feature of A. Obesity, B. Overhydration, C. Cushing syndrome, D. Diabetes mellitus. Correct answer here is C. Cushing syndrome is a clinical features of Cushing syndromes. Testosterone is produced by A. Sertoli cells, B. Leydig cells, C. Ocentic cells, D. Pituitary glands. Testosterone is produced by Leydig cells. Answer here is Leydig cells. Okay, this is the last question we discussed today. Please, if you find this videos helpful to you, please like, share and subscribe. Thank you.